Good afternoon and welcome to this Thursday's Facebook Live. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management. And today we have a special guest, Liz King, with us. She's the Nursing Director at the St. Clair County Health Department, and she'll be filling in for Dr. Mercantile today. Welcome, Liz.
Yeah, thank you. Thank you for having me.
All right. So as we always do every week, and I'm going to try and get my camera set up. All right. So we have 9,114 total cases to date, 524 hospitalized with 251 deaths throughout the county. And currently we have 7,362 recovered patients. Changes in the last 7 days, we are seeing a pretty steep incline or rise in the cases with 309 cases this week, 44.1 average new cases per day. Unfortunately, we're only testing roughly 300 people per week or per day right now, which is much lower than we would like it. And our percent positive of those tests is 8.4%. Here's the steep incline that I spoke about. As you can see right now, today, we are at a level of where we were in late November and early December. And we're doing everything, we're working to get that to turn the other way, but it's still creeping up pretty quickly. And then this is, as always, our percent positive for testing. You can see it's been pretty low the last 6 weeks or so. And we're holding steady at, like I said, 8.4%. And then finally, our vaccine data. You've been seeing this the last few weeks. We've administered 34,988 doses to St. Clair County residents. And we've been distributed 42,810. And as always, you can find the data up to date every single day at stclaircounty.org/offices/health/COVID19.aspx. That's our dashboard. All right, well, let's get started.
All right, you guys ready to go?
Ready when you are.
All right. I don't know if Liz is frozen or not.
She
Liz,
is,
can you
so
hear?
we'll just start with me.
Okay.
We'll go with, yeah.
All right. Justin, can you go over some talking points on COVID-19 testing? You kind of mentioned it when you were doing the data, but just a little bit about it more.
Absolutely. So right now, testing is always one of our top capabilities to slow down transmission and kind of put a bottle around it. And right now, we're kind of losing that battle because we're not doing enough testing per week. And we have, even though we're not doing a lot of testing, we still have a high percent positive. And that all tells us that, that we may be in trouble and we need to take some actions to turn that around. So St. Clair County Health Department's holding testing clinics every day, Monday through Friday at 1168 Gratiot Boulevard in Marysville. And appointments are scheduled through the health department's website, or you can call 810-987-5300 and follow the prompts.
All right, thank you. Do we have Liz back on yet? Hi,
There
Liz.
she is.
Are you there?
I'm
All right,
here.
now we can.
All right. Awesome.
Liz, Justin just went over when you were frozen there. He just went over the COVID testing in Marysville and such. And then could you go over some talking points for the people watching on the pre-registration? Just an update on that.
Yeah, you bet. So as of today, we're showing only 726 individuals who are 65 and older left in our pre-registration system who have not been vaccinated. So we're very, am I frozen again?
No,
we can
you're
hear
good.
you.
Keep going.
Okay. So the good news is when individuals, they'll still get those calls, our 65 and older crowd, they need to either press 1 to accept the appointment, press 2 to decline the appointment. Maybe it was a bad time for them. They can't make it that day and it keeps us. Or 3 actually removes them from our list and they're letting us know that they received the vaccine at another location. So those final individuals who are 65 and older in the registration system, we hope to get through in the next week. And then our 50 and older with underlying conditions, we started working through that list this week. Again, watch for those emails and phone calls to get pre-registered. Let's see, what else? For those without internet capabilities, under 65 who need assistance, you can use 211. Also, you can use the Michigan COVID hotline at 888-535-6135 and press 1. We're also encouraging everybody to register where you can. So this week, we know pharmacies, Kroger's and Meijer have expanded their allocations. They're getting federal allocations larger now. So use their systems as well.
Okay. And just a reminder, if you get an appointment somewhere else and you're on multiple lists, please let those places know or decline the appointment so we can take you off the list and move other people up.
Right, exactly. And you can always call here as well, and we can do that for you. We can remove you if you're unsure how to log back into the system.
Okay, thanks, Liz. All right, we're going to go through some questions now that came through last night, and then we'll get to the live questions. Justin, this is about our pre-registration system. This person,
Okay.
I have a brother who's 89 and hasn't been called yet. Why are 60-year-olds being called before him?
So I think Liz just hit on what may be happening. That 700 or so people that are over 65 that are on our list, for some reason or other, either they did not answer the call that came through, the multiple calls that came through, or when they did, they didn't understand what was going on. So Liz just gave some really great instructions on how to manage, how to get through the system and ensure either you get an appointment or you don't need an appointment anymore, and it'll take you off the list. And like Liz also said, sign up on as many lists as possible, and those lists are continuing to expand in places like Meijer, Rite Aid, and some other facilities throughout the county and the state.
Okay. Thank you. All right, Liz, this question came in last night. My husband and I are both 60 plus with underlying health conditions. Monday opened up for our group to be vaccinated, but we have not received a call. When can those 50 and over with underlying conditions expect to be scheduled? And do you have the Johnson & Johnson one-shot vaccine available?
Okay. Couple questions in there. So first off,
Yep.
like I said, we are starting your group this week. We have over 3,700 people in that group to pull through the vaccine clinic. So be patient. It might take a couple weeks for you to be contacted. And do we have Johnson & Johnson vaccine? We have gotten a very small allocation of Johnson & Johnson vaccine. That was our first batch of that came in last week. And so we'll have all 3 presentations. We look forward to administering and getting more doses. But I do want to say, we encourage everybody to get the very first dose that's available. Don't hold out for a certain product, because we don't even know which products we're getting in weekly. So CDC, MDHHS, all of us here at the local health department want you to get vaccinated as quickly as possible. So we'd like you not to pass up on appointments because of what vaccine is being offered.
Thank you. That's a great point. We have been getting more calls on that. Thank you. Okay, Justin, I'm fully vaccinated and going to visit a person who is not. They are pre-diabetic and obese. Should I wear a mask in their house? Are they considered high risk?
So they are considered high risk with having those illnesses and things they're dealing with. So it's always recommended when you're with unvaccinated people that have risks associated to wear your mask when you're within 6 feet or within a social distance. So yes, you should be wearing your mask until both people or both groups are vaccinated.
Okay, thank you. Liz, this question, when and if the boosters are recommended, I've heard perhaps maybe in the fall, do we still have to stay with the same vaccine brand we started with? Or at this time, is it okay to mix the brands? As always, thank you. Your hard work is appreciated.
That's nice. Right now, we're unclear if a booster dose is going to be needed. I know there are some studies coming out on the effectiveness for Pfizer and Moderna vaccine that can protect against COVID-19 variants. So that, and as well as Johnson & Johnson, I'm sorry. Right now, no booster doses are needed, and we're thinking what we have will give us protection. We just have to wait and see.
Okay, thank you. Justin, this is another pre-registration question. My wife and I submitted our info at the same time. I got my first shot, and now I'm going to get my second one soon, but she still has not been called. Can I find out where she is on the list?
Absolutely. So what you need to do is email us at covid19@stclaircounty.org. Send us your name, your contact info, and the name, and we can go through and take a look at what might have happened there.
Okay, thank you. All right, Liz, this person says, when I've got my first vaccine, when I got my first vaccine shot at Kroger last week, the man said if I wanted, I could come back 2 weeks after my second one and have an antibody test. Exactly what would that tell me?
So an antibody test looks for antibodies in your blood after you've had the actual disease. I'm not sure why that was offered after a vaccine. That's not a recommendation after you get a vaccine to get the antibody test. An antibody test is looking for, like I said, the antibodies after you had the actual disease. I'm not sure why that was offered, but that is what it would tell you.
Okay. Justin, you might be able to answer this. Hello, what vaccine will be administered at Saturday's vaccine clinic at the Blue Water Convention Center?
So I might kick it over to Liz for that, but I do have a comment on that. Like Liz said a minute ago, it really doesn't matter which vaccine is available. You should jump at the first opportunity to get any vaccine that's available to you. And I will punt to Liz on if she knows which vaccine will be given.
Moderna. Saturday, Moderna.
Thank you. All right, Liz, back to you for a second. Will taking my methotrexate, if I said that properly, interfere with my COVID vaccine shot? Will it interfere with my COVID shot?
So first off, I want to say that
you're good.
That I'm good. I'm not frozen.
Yep.
That it is not a contraindication to being vaccinated, so that's great news. But our immune suppressing drugs sometimes people are cautious about getting vaccines with. We would recommend you could check with your private physician on that. The studies aren't out yet how your immunity will build post-vaccine, but we do encourage you to get it. There's nothing that says that you shouldn't get it. You definitely should be vaccinated, and wait for more studies and trials to come out.
Okay, thank you. All right, next question. This is now on the live feed. Are people having less side effects with Johnson & Johnson? My elderly parents had no reactions to Johnson & Johnson. I had Moderna and I had many side effects.
I guess I can take that. We only had the one clinic with Johnson & Johnson vaccine, and we have not got increased calls of differences in any kind of side effects. We didn't notice anything different at the clinic afterwards, and I have not heard that.
Okay. Next question. Why is testing way down below where we would like it to be? Not enough people showing up to get tests, or not enough testing capacity to handle the need?
Yeah, I'll take that one. So we have plenty of capacity. We have the most capacity we've ever had through this entire response so far. So that is not the issue. I really think the largest issue is people are, not going to get tested when they should. And that is part of the issue and why we're going up in case count.
Right, I would agree. Justin, I know our Marysville site is, there's availability same day. So testing is available out there, and we have different tests available that we can administer. So it's there if someone wants that test.
All right, thank you. How long should a person wait after their second COVID shot before getting a shingles vaccination?
This one should not stump me as director of nursing, but at this point, I don't want to say something that's inaccurate. I think,
We can get back to her on that.
yeah, we
We'll
could.
find out.
I think
Yeah.
I would just be going through my nursing logic at this point and talking through it, and I don't want to do that.
Okay. We'll get back to you, Margie Collins, on that at another time. Okay, next question. Why isn't the National Guard assisting in vaccinations like Sanilac is doing and working to have vaccine distribution? What about opening up parking lots like Kmart, using vacant buildings to set up?
Sure, I can take that one. That one's very easy. So we have a little bigger staff here in St. Clair County than Sanilac County does, and we are meeting demands currently with the number of vaccinators we already have, both within the health department, around the county, in our different pharmacies, and with our volunteers. We have not had the reason to call the National Guard yet, but they are available to us should we exceed the capabilities internally in the county.
Anything you want to add to that, Liz, or you good?
No, just that there was a comment about outdoors, I think, right?
Yep.
Being outdoors. So
Yep.
we are looking to move to outdoor vaccinating or possibly drive-through clinics, but you know, it's Michigan, it's the weather, and we've been very aware of that up until now. So we've kind of been battling that, but moving forward, that's definitely an option.
Okay. Somebody asked again what vaccine we are using this weekend, and at the convention center, we are using Moderna. Are we doing another clinic, though, for that closed population?
We
on the
are,
south side?
and yeah, that'll be Moderna as well.
Okay. Moderna. All right.
So Jen,
let's-
circling
yeah.
back on the
Sure.
shingles vaccine, it's 14 days.
Okay. Oh, thank you. All right.
Yeah.
Next question. Cases are on the rise. Are new variants present? That's the first question in this.
Mhm.
Do you want to,
And
anyone want to
Liz,
go
do you
for
want to
that
take
one?
that one?
And then I'll finish the rest of her questions.
Cases are on the rise, yes. New variants, yes. We've had 2 cases of the B117 here in St. Clair County.
Okay. Then she says, my daughter has been in school for several months with no issues, but now she is one of over 200.
Yeah. So
Transmission.
So I think that there's something going on where we've got some tiredness, some fatigue dealing with this response now. And we're not doing the testing that we probably need to do to ensure we know where it is at all times. And B, people are just kind of over this a little bit, and they're not going and getting tested when they should. They're not reporting that they've been tested and waiting for that system to do its thing. But sometimes it's delayed with the high number of cases that we're having again now.
Mm-hmm.
Okay.
Mm-hmm.
Liz, do you want to add anything? When this woman asked, does this mean there is an increase in school transmission?
No, I guess I could just tag on to what Justin said. We're working really closely with the schools. I think I'm frozen. Am I frozen?
No, you're good.
Hear,
we can hear
you. Mm-hmm.
Okay. We're working really closely with the schools. We look at that school data almost on a daily basis, what's going on. We are watching very closely for outbreaks and then sustained transmission within the school. And it is concerning, like Justin said, we've seen an increase, but we're watching it closely and going to, make any recommendations to the schools that we see fit.
Okay, thank you. All right, the next question. When I received my notice, I was able to pick an appointment time. My husband was offered the same time and had to decline. Is there a change when you are unable to choose your time?
Yeah, so you're basically just put back into the pool, and then the next time there's a clinic the system will call you again and announce if you did decline previously.
Okay, thank you. The next person talks about they want to wait for the Johnson & Johnson vaccine. When will you have that? And they may have missed earlier in the show. So I don't know if you just want to circle back to reiterating
Sure.
what we talked about.
Right. Again, we don't know what type of vaccine will be allocated to us, when it will come, when it will show up. The last batch of Johnson & Johnson was kind of a surprise to us, and we do have only so much time to administer that. So we don't encourage you to request which vaccine you want. Don't encourage you to wait for a certain brand of vaccine either. What's recommended is you take the first vaccine that's available. However, we have had people who are requesting a specific vaccine. So I would accept your appointment when you get the call, then call the health department if it's that important to you to know what kind of vaccine you're getting. And we will let you know what'll be available there. And if you do not want to come or receive that vaccine, we will take you off the list.
Okay, thank you. Next question. After having both Pfizer vaccines, is there a way to see if my immune system is working well to protect me from COVID? Because I have a lower immune system to start with due to chemotherapy.
We don't encourage any post-vaccine testing.
Okay. Next question. I'm 50 years old with diabetes and I'm immunocompromised. I can't find a place to get the vaccine. Why?
Well, again, I hope you're on our list. I hope you've pre-registered. And then again, pre-register with the pharmacies and the other providers in the community. And I think they will call you soon. Again, just be patient. It's going to take us a couple weeks to get through this population.
How many, Liz, did you say are pre-registered on our system that we know of already in that category?
Close to 3,800.
Yeah, so there's quite a few. Okay, the next question is, if you can get an appointment in another county, is that okay?
Yes. Take it wherever you can get it at this point, as soon as possible.
The next question is, what classifies as an outbreak in a school building?
So 2 or more cases, epi-linked, that do not share the same household.
Okay.
So outbreaks can happen. I guess let me expand on that. Outbreaks can happen,
Okay.
but what we're looking for is sustained transmission around the school. We have outbreaks in pockets that will happen. You know, with that definition, you can see how easily that could happen. But we're looking for transmission around the school outside of those outbreaks. That's when we're really concerned. Outside of those clusters.
All right, thank you. The next question is, I'm scheduled to get my first vaccine on Saturday. Will the second appointment date be given when I get the first one?
Yes, it will. You'll have the opportunity to schedule that right when you're at the clinic.
Okay, thank you. I've read this morning that other countries have stopped using certain vaccines due to blood clotting. As someone who has vascular issues, this is why I prefer the Johnson & Johnson. I'm not sure if you want to comment on that, or we'll take that one to Dr. Mercantant when she returns.
Yeah, that's what I would recommend. I don't have a comment. Nope.
Okay. Okay, well, right now we don't have any other questions that I can see coming through. So, any other issues we might bring up?
Yeah, I've got something. So I've seen at least 3 or 4 questions where people are saying, you know, I only want this vaccine or I only want that vaccine. So almost everywhere you go right now, they're really not going to give you a choice. The only choice you're going to have is, well, I don't want to get my vaccination today. You're not going to be able to pick and choose. Like, there's not a cabinet with all 3 vaccines in there and you just pull one out. The logistics are much more difficult than that. And I just want everybody on this Facebook Live event to understand that it really is in your best interest to take the very first dose that you can get your hands on, regardless to what you may want.
Okay. This one other question came through. Will you please send a message for people to make sure they get tested and seek a positive test result if they think they have COVID?
Yeah, I think we're always doing that. Yeah.
Mhm.
So,
Okay.
Yeah, of
yes.
course.
Oh, she continued. My son tested negative in January despite having symptoms. At the same time, my husband and I were positive.
Yeah, we definitely want and encourage that testing. Like we said, at the Marysville Clinic, you can get a same-day appointment. It's very easy, quick testing. We're doing rapid testing as well. There is no charge, like came through here. So you need that test, kind of to get you into our system, start that investigation, and for future issues that may happen with quarantine and vaccinating. So it's best to get tested and get it all documented.
She continued on one more thing. She said, he has the antibodies now, yet he's still required to quarantine.
Mhm.
Yeah. So
Yes.
the timeline on that is if it's been more than 90 days since you were last sick, you will be required to quarantine because you can be reinfected. And I was going to say too, when you said your son tested negative, he may have been not shedding as much of the virus yet. Dr. Mercaton talks about that all the time, where your son may not have been shedding as much as the other two, and the PCR test in January just didn't pick it up. So that may have happened. That may have been what the issue is.
Somebody else asked, the Michigan school list doesn't list any in St. Clair County, yet students are being sent home, ?
Five outbreaks were added on Monday. Will be added. I'm sorry. We kind of report a week behind. So go ahead and check that again.
Okay. And that's all the questions that I see today. So I don't know if you guys want to drive home any last minute points before we end. We're going to actually end at 4:00 today, or if you just want to do closing comments, or both.
Liz, what do you have?
So much. No. I think we touched on a lot of the points we've seen in nursing this week with testing. So the decrease in testing and why it's so important to get that test. Also, what's been a really hot topic, like we've already talked about, is the choosing a vaccine and starting to get a little choosy in what vaccine you're offered. And we absolutely discourage that. That's going to be a slow uptake if we don't administer what we're given and have everybody take that. So those would be my points. And I guess to just continue what you're doing, all those mitigation strategies. We kind of talked about that a little bit, but with the numbers going up, we need you to, keep doing what you're doing. And thank you. I appreciate all the kind thoughts at the clinics, all of our staff and volunteers. It's nice to be out and be in a hopeful environment with people. So we've really enjoyed that and we appreciate it.
Okay, thanks, Liz. Justin, how about you?
Yeah, so
Closing comments.
obviously a couple of things. Number one, I just want to remind everybody that both isolation and quarantine are legal requirements during this pandemic. So, if you've been told to quarantine, or obviously if you're sick and isolated, you are required to follow those quarantine rules by law. So, we've seen anecdotally, or we've heard anecdotally, that there are people going to events after they've been sent home in quarantine. So we just need everybody involved to understand that alone is a big driver in stopping transmission. And, as Liz said, I want to thank the community for being so nice and generous at these clinics. The health department staff is working around the clock to provide service during the pandemic. And it's always nice to hear that things are going well. So with that, everybody have a great weekend, and we'll see you next Thursday again at 3:30. And please continue to send us your questions. Have a great night.